Hi, my name is Anita Chan. I'm the Program Coordinator at Arthritis Consumer Experts. I'm here today with Dr. El-Gabalawy. Can you please provide our audience a short introduction of yourself and what you do?
Sure. I am a rheumatologist. I'm a professor of medicine and immunology at the University of Manitoba, where I have been for about 25 years, except for a 3-year period that I spent at the NIH in Bethesda, Maryland, from 97 to 2000. I currently have a research program focused on the preclinical stages of rheumatoid arthritis with a particular focus on the First Nations people who have a high prevalence of the disease. I also have a new administrative role for the last couple of years, which is as the scientific director of the Institute of Musculoskeletal Health and Arthritis for CIHR, which has taken me away a little bit from my research, but I'm trying hard to sustain the momentum that we have.
What do you think is the most exciting thing coming out of this year's CRA meeting?
In my mind, I don't think it is any one aspect, any one piece of information. In my mind, it is, number one, the size of the meeting is the biggest one ever. So clearly, we're going somewhere with this organization. And the tremendous number of young trainees, fellows, internal medicine residents, students, people presenting oral presentations who are at an early stage of development clearly is very encouraging as to the future of our discipline and where we're going with it.
There's a lot of use of social media during this meeting. They have an app for the meeting. So what do you think about social media in relation to patient care and medical research?
I think if we don't embrace that, we are missing the ball in a very big way. This is the way that information is transmitted in 2015, and will certainly not decrease in the next number of years. And the more we embrace this with insight and especially with young people who are very facile with it, I think that ultimately will engage a much wider group of people than we otherwise would.
This year you were involved with the CRA Great Debate, whether to treat or not to treat pre-rheumatoid arthritis. You were on the against side?
Yes, yes. I was on the no side.
Okay.
Yeah.
Can you tell us a bit about, maybe define for our audience, in case they don't know, what pre-rheumatoid arthritis is, and then kind of share us how you walk through that process of preparing your argument for the Great Debate?
Sure. Pre-rheumatoid arthritis, a concept has emerged in the last 5 to 10 years, and it has really been spurred by the fact that the antibodies associated with rheumatoid arthritis, rheumatoid factor and anti-citrullinated protein antibodies, are known to be detectable in the blood of individuals years before they develop the disease, and in fact their levels go up higher and higher until ultimately they develop a clinical manifestation that can be defined as rheumatoid arthritis. So we have been thinking about this as the preclinical period, or pre-RA, and see this as an opportunity potentially, if we can turn the immune system off at that stage, before any inflammations happen, before any damage has started at all, that we may be able to get some cures or preventions before the disease starts. So that's been the exciting part about that. Now, as I mentioned, my research has been focused on trying to understand that preclinical stage of RA by looking at the family members of First Nations people who have RA, where it's quite common. And I was asked by the CRA to participate in the Great Debate, and I was assigned the task of defending the no side. And it was interesting because ultimately I'm working towards developing enough evidence, scientific evidence, to completely confirm our need to treat at that stage. But I was left defending the arguments against that, which I think are valid arguments, and they result from the fact that we really don't understand what that preclinical stage looks like, aside from having these antibodies in the blood of individuals. We don't have good risk models. We don't have good public health models to work with. We don't have good economic health economic analyses. So there's a lot we really need to understand before we can embark on prevention programs along the lines that you see in cardiovascular medicine, for instance, with cholesterol-lowering drugs and hypertension and so on.
You were also the keynote speaker. Can you share some highlights from your presentation on that?
Well, what I did during that talk is really presented what we do know about that preclinical stage from my work and from the work of others who have studied it in similar and in many ways different approaches. And it's particularly the genetic risk factors, the environmental risk factors, and how they come together to initiate the autoimmunity that we see in RA. And then our studies on following individuals longitudinally to see what happens to them in terms of both clinically and in terms of the biology of what's in their blood, and to prepare the ground for many of the issues I've already raised, which is when do we feel comfortable that we know enough to be able to start to try to prevent the disease, and if we do, with what? With medications we know, such as mild DMARDs like hydroxychloroquine, or do we do it with new biologic treatments that are very specific for pathways we want to target that turn off the autoimmunity? All of these are important questions, and that's what I tried to point out in the talk.
And do you find that it's a physician's job to look for pre-RA, or do you think a patient themselves can identify whether they have it or not?
That's a great question, actually. By definition, I don't think patients can identify whether they have it or not, because at this stage, it is primarily based on identifying antibodies in the blood, which in an individual who doesn't have any symptoms. And on the other hand, we've also studied this. There are many individuals who have joint symptoms, aching, pains, and stiffness in their hands and their feet and their shoulders, who think that this is the early stages of RA, and what we test their blood, there's no evidence, no biochemical evidence that they have. So this mismatch between symptoms and the biological phenomena that we associate with RA is quite difficult to deal with from that point of view. So lots of people can say, I have pre-RA because I'm aching and stiff, and they go to the doctor, and the doctor says, well, no, I don't think you have pre-RA. You might have fibromyalgia, you might have osteoarthritis, you might have a whole bunch of other things. And then there's the other person who gets tested for antibodies for something else completely different, and the antibodies are found to be positive. And then the doctor doesn't know what to do with it, so they send it to someone like a rheumatologist who tries to sort this out. And we asked that question today in the talk that I gave. Based on just the lab tests, how many rheumatologists would treat? And the majority would not treat, just even if there was a high level of certainty that this individual is likely to go on to develop RA, but they're otherwise asymptomatic. Most of the rheumatologists would not treat unless they had symptoms, even though they know they have a 40-50% chance of having RA in a couple of years.
Yeah, and just to follow up with that statement, I think the stats was like 70% would not treat it, and then the other two options was like 20%.
Yeah, exactly.
Yeah.
Treating only if they had symptoms, or treating if they do MRIs and ultrasound and things like that. So it was really indicative to me of how current rheumatologic practice views this pre-RA dilemma.
Doctor, I want to congratulate you on being awarded the Distinguished Investigator Award. Can you comment on that and how you feel about that, and what took you to that step there?
I feel, it's stating the obvious. I feel very honored to be selected by my peers for this honor, and I've been coming to these meetings for many years, and they are. You really feel like you're in a family, and you've watched young people get into the discipline. I've grown gray here along with my colleagues. So that it really is a large extended professional family. And to be recognized by that family is really a very comforting and at the same time honorable thing to have had.
Great. Thank you so much, Hani, and I wish you enjoy the rest of the conference.
Great. Thank you, Anita.